Dr. Dulcie Wanda. I'm a Clinical and Radiation Oncologist. Thank you very much for joining us today. Welcome. Today we're going to talk about how to protect yourself from cancer. I think that's a question that's asked very often. How or what can I do to ensure that I do not get cancer? If we look at the statistics, today we're going to talk about one of the preventable cancers, cancer of the cervix. Why it's dear to me, if we look at the statistics, it's the second most common cancer among women in Kenya, meaning in terms of morbidity, the number of patients who have it, those who are sick with it, and even those that we lose. Cancer of the cervix ranks pretty high. And this is one of the cancers we can do a lot about. If we look at Kenya compared to the West, our statistics in Kenya are very high compared to the West. What's the difference? Vaccination is one of the very important ways to ensure that we are able to fight this disease. So vaccination in Kenya has always been present. I think for many years in the private sector, then one would get the HPV vaccine if they wanted to get vaccinated. However, many parents, even when the government rolled out a free program to vaccinate the 9 to 14-year-olds, the uptake hasn't been very good. So it's really shocking to see many parents not allow their children to get this vaccine because it prevents them from getting cancer. Cancer, a disease that is very hard to treat, has a lot of psychological torture in terms of how you manage it, and also just the mental torture one goes through. So for me, I think vaccination is really important. The uptake is low, and it's really shocking to see that. Among us health workers, we are very surprised that parents are not allowing their children to be protected from cancer of the cervix, and that's number 2 cancer in Kenya. So I think understanding how vaccines work is very important. So I think the big question that's always asked is, how do vaccines work? Why is it important? So to break it down, a vaccine prepares the immune system to fight a virus or to fight an infection. So once you get the vaccine, your white blood cells are ready. White blood cells are the cells that fight disease in your body. So once you have a vaccine, it's like you've prepared your army. So in case the virus comes in this case, the virus would come in from sexual intercourse, where if the person you're having sexual intercourse has the virus, the Human Papillomavirus, in short HPV virus, you would get infected. And once you're infected, then it means the body is going to have the cervix having changes that are cancerous. Some of the cells will change and become cancerous, and later it can grow and even spread to the whole body. So it's important to get vaccinated because you're preparing your body. Should you be exposed to the virus, it can fight it off. Meaning we will be able to reduce the number of women who are getting cancer of the cervix, who are getting sick from it, and even who are dying from cancer of the cervix. So it's really important. It's sad that many parents are not seeing the importance of this vaccine, but they're giving their children other vaccines. For example, they're giving their children the BCG vaccine. They're giving the children those vaccines that are given when the babies are very small. They're able to take them. And we've even improved. We have baby-friendly vaccines. So most parents are able to accept that. But when it comes to the human papillomavirus, they're not taking it up. And this is my appeal to you parents. Do you have a daughter? Is your daughter between the age of 9 and 14? It is very important you take her to hospital. The government of Kenya is providing this vaccine free of charge. You are able to prevent your daughter from getting cancer. I think that's a wonderful concept. And if you love your daughter, you will take your daughter for vaccination. Looking forward to seeing you in the hospital getting the vaccines. Thank you very much for watching. Let's continue the discussion on cancer.